Hi. Um, I, I just wanted to say that a tribal pylon directed at one bad boy celebrity billionaire is not empowered movement building politics, right? Focusing on one person. Like when the Pink Hat March in Oakland decided that they were going to have a big march in favor of Jeff Sessions. All because celebrity bad boy Trump had said something, was trying to fire him or something like that, right? So Trump was having one of his little, arrogant pissing matches with Jeff Sessions, and so suddenly the Pink Hat Marchers decide they're going to have a big giant rally, a big thing, not for affordable health care, not for the public option in health care. Nope, they're not going to do that. Not to end defense contracts and nope, not that. It's going to be to save Jeff Sessions. Well, now there's this big thing against Elon Musk, and everybody on my Facebook feed, all my smart friends, they're all doing really cool things like dramatic banner paintings in front of Twitter, mural paintings, I'm sorry, on the street in front of Twitter. Very beautiful. They're taking this dramatic, coordinated, cool action now, spending all this paint, doing this now to say what? We don't like Elon Musk. Okay, got it. Message received. And then all my friends on Facebook coming out of their Facebook silence, to make snarky remarks about Elon. I'll throw all kinds of jokes about Mars and Elon and all this stuff. It's all over. And that's great. But the unfortunate thing is that they have never made a snarky remark or a joke about Lloyd Austin or about Raytheon or about entities that are actually in power right now. They're actually winning the defense contracts. have the defense contract just on a perpetual loop, like they know they're going to get that money all the time. So we're not doing anything about that. And that's horrible. And in the meantime, our healthcare system really is failing. And what's happening, if we had any independent reporting about it, we would know that people are dying with tumors, cancerous, tumors, and they're dying from diabetes and heart disease and lots of other things that could be treated if they were caught earlier, treated more aggressively, as if these people were, private members, diamond members at John Muir, that's what would have happened. They would have an early diagnosis and aggressive treatments. But since they're bronze members at Kaiser or below, and the system now, we just accept that they can't seem to get along with their nurses. There's like always nurse union strikes, things happening. Nurses saying, wow, we're way overburdened. This is not working. We can't give the care we need to give. Nurses have been saying that. We know that there's long wait times. What long wait times mean is that people die. So we're now just accepting long wait times. And then they kind of try to blame. There's this whole game of like, well, wow, look at that guy over there. He's not wearing a mask. Oh, bummer. You know, that doesn't even matter. The guy's not wearing a mask probably already had COVID. That would be logical right now to assume that actually probably already had Omicron and already recovered from Omicron. If not, there's also a really high chance because of the pressure campaigns that he's triple vaxxed and quadruple boosted. So in that case, if these things are doing what they say they're doing, then you also shouldn't worry about that guy. What you should worry about is that the private equity owned monopoly healthcare system no longer maintains extra capacity for normal winter, just like a normal flu outbreak. Right? It doesn't want to have extra beds in the ICU. It doesn't want to have extra beds in the hospital because that's expensive. That's on the expense side of the ledger. It's a for-profit company reporting to its shareholders. So it's, expense, huh? Yeah, no thanks. Maintain extra stuff in case there's an outbreak of something, and nah, not why bother. Handle a normal winter even, yeah, maybe not. Let's kind of just keep operating on this barely functional level. Long wait times, and it's impossible to really see a doctor. Many people are discovering they can maybe get a phone call or Zoom or something. They have trouble getting signatures for things, having trouble getting procedures done, getting referred for imaging that could catch things. So this is the crisis we're having. And yet no one can face it. No one can see it. Because the other crisis we're having is that we don't have journalists anymore. Journalists are in prison. Journalists are banished. Journalists are dead in record numbers. Real journalists. And on our broadcast media and our media here in the United States, we have nothing but repeated talking points from corporations. It's a corporate coup. It's completely captured our media. And we need to admit that. And the left, everyone, we're kind of reticent to do that. Kind of reticent to, are you a conspiracy theorist? Oh, Jeff, you're not saying that talking points could get fed out from one really super connected PR firm and could just go to lots of media outlets all across the country, and that they could kind of all be repeating the same talking point on any given day, including your old buddy Van Jones over at MSNBC. He wouldn't repeat talking points, would he? Oh, well, sad truth is they do. On any given day, you tune in, any broadcast media, left, right, center, doesn't matter, local, if it's a Fox affiliate, if it's a MSNBC affiliate, if it's a CNN broadcast channel, it's going to be repeating these, whatever the talking point is of the day. You've heard some of the talking points recently. For the last election cycle, the phrase was democracy is on the ballot. Democracy's on the ballot. Anyway, that was just a particular talking point. I'm not saying that was a bad one or a good one, but democracy wasn't on the ballot in 2016 or in 2020 in November, that's for sure, because the primary was so rigged. So democracy wasn't on the ballot in June of 2016, that's for sure. But at any rate, so this is a problem, though. The fact that we don't have media, right? So now when there's no one, I can't expect anybody to have a baseline of any kind of information about anything. Russia, Ukraine, how vaccines work or don't work, common knowledge, virology, whatever. There's just, you can't take anything for granted anymore. People are out of their minds. And it's really not their fault. They're being hit with just a saturated media environment that just repeats and bludgeons them until these truths become truths in our culture when they're in fact completely wrong. So and then also cognitive dissonance. People need to admit that they have now themselves been a part of it, embraced it, put it out there. At one point, they were repeating what Rachel Maddow was repeating, that if you get vaccinated, the virus stops with you. That's a direct quote from Rachel Maddow, right? So in other words, the vaccine does stop the spread. And we just all have to just go rush out and get the vaccine. And as soon as we do, spread stops. Like, right there, no more spreading. And then they had all these events where all these people were completely vaccinated, and they spread it at the same rate or at a higher rate as events where people were largely unvaccinated. So it flew in the face, and then they had to admit, okay, well, what it does is prevent you from getting more ill, right? But they never bothered to say, hey, okay, look, we have to kind of go, admit what we said earlier was wrong, and kind of, really come out with this idea that actually getting vaccinated, they're not really vaccines. What they are is preventative treatments, because they prevent you from getting worse if you get it, but they don't actually prevent you from getting it, right? A vaccine would actually prevent you from getting the thing, right? So that's cognitive dissonance. It's like they made a whole Western civilization, basically. The East, too, apparently, Eastern authoritarians, they all embraced this narrative that we could somehow vaccinate our way to COVID zero, that we needed to keep aggressively, vaccinating and boosting people even after the vaccine, the virus itself had already morphed into the Omicron variety and was much milder. It was actually, in fact, going endemic, and people were getting it. So there was actually no really way to stop the spread. So the whole narrative should have shifted, but it didn't. The vaccine manufacturers, Pfizer, Moderna, Gilead, whatever, I don't know if Gilead, they have a remdesivir. But anyway, these pharmaceuticals that underwrite much of our media just kept this whole narrative going. They're like, oh my God, we've already, we've got this deal going with vaccines, and everybody seemed to kind of liking this mandate power that they have, this element of control. Authoritarians are embracing it wholeheartedly, many of them. So, and then Democrat capitalists in the West are also have locally, various places have experimented with control measures, curfews, lockdowns, when this virus is now Omicron variety, and it's no longer any more deadly than a flu, right? And now here we are in a winter, we are having flu. So we have this thing in the winter, it's called flu. Hey, who knew, right? And but the system doesn't tell you things you can actually do to combat either the flu or COVID. It just kind of leaves you, oh, well, if you become COVID positive, I don't know, what are you supposed to do, right? You don't really have a clear answer for that. You've been told that ivermectin sucks. You've been told that there's nothing, all these things have been vilified in your mind. These cocktails that other people have used in early treatments successfully. But anyway, and for us, nope, that all sucks. Can't do any of that. So you don't really have any options except, no, look, Pfizer now has Paxlovid. It's an analog of ivermectin. But hey, look, now that it's patented under new patent with Pfizer, and all right, let's go crazy with Paxlovid, So here comes Paxlovid, and nothing but Paxlovid, right? That's what's so suspect. That'd be fine if we could see. That'd be normal operations. If pharmaceutical has its connections, that it releases its little early treatment protocol. Here we go, boom. Okay, that would be kind of normal, but not the way it is now.